Hello, good afternoon everyone. My name is Anirudh Padki and I'm a current fourth-year PharmD student at Massachusetts College of Pharmacy, Health Sciences University. I serve as a committee member for the Policy and Advocacy chapter for APhA-ASP. Today we have with us Dr. Roseann Gammal, who is a current assistant professor of pharmacy practice at MCPHS University and has been for the last 3.5 years. Dr. Gammal has completed her PGY1 pharmacy practice residency from University North Carolina Medical Center. She then did her PGY2 residency in clinical pharmacogenomics at St. Jude Children's Research Hospital. Dr. Gammal is also the co-founder and lead clinical pharmacist at the Pharmacogenomics Clinic at Brigham and Women's Hospital. Thank you so much for joining us today, Dr. Gammal.
Thank you for having me.
Okay, so let's just get right into it. The first question I have for you is, what is pharmacogenomics about and what does it mean for our health? Why should we be interested at all?
That is a great question. So pharmacogenomics is the study of how our genes influence how we respond to medications. So we know in clinical practice that patients respond differently to the same medication, and there are many factors that go into that, but genetics is one piece of that puzzle. And so the idea is if we can do genetic testing on our patients and predict before they get the therapy how they're going to respond, then we can figure out what is the best dose, what is the best medication for them based on their unique genetic makeup, and that's what we're trying to do with pharmacogenomics.
Okay, that's great. So that leads me into the next question. What is a typical workday like for you in a pharmacogenomics clinic?
Yeah, so I started a pharmacogenomics clinic at Brigham and Women's Hospital just this past year. And what we do is we see patients from all over the health system. They could have any number of conditions beyond any number of medications, or they could self-refer to clinic or get referred by their own physician. And typically the patients we see have had past bad reactions to medications, maybe a lot of therapeutic failures, adverse reactions, and they're coming to us looking for answers, looking to see is there something in their genetic makeup that can predict how they're responding. And so when we see them in clinic, I educate them about what pharmacogenomic testing is, what are the benefits of testing, what are the limitations, and we kind of assess together, does it make sense to proceed with testing? And if it does, then we get a DNA sample, so it's a simple cheek swab, and then we send that out to a laboratory that does the pharmacogenomic testing, and we get those results back. And then as the clinical pharmacist, I analyze those results and come up with specific medication recommendations for the patient, and we bring them back to clinic a second time in order to review those results with them, and we document those results in the EHR, and we share them with the patient's provider.
Great, thank you. So how much progress have we made with implementing pharmacogenomics into clinical practice?
That's a great question. So nationwide, I would say it's definitely increasing. All the time I see new programs popping up. A lot of the large academic medical centers nationwide have started really putting a lot of resources into this and hiring people with this sort of expertise in order to start a clinical pharmacogenomics program. My clinic is one of the first of its kind in the country, so it's definitely a new area of practice, a new practice model, but there is growing interest. And I think as technology continues to improve and the cost of testing comes down, we're going to see increased access and more patients getting this information. And we also see direct-to-consumer pharmacogenomic testing coming as well, with 23andMe got approval from FDA recently in order to release pharmacogenomic test results directly to patients. And so once patients have this information in hand, they're going to turn to their healthcare providers and ask about, what does that mean for them and their health, and we need systems in place in order to appropriately interpret that information and provide the right guidance.
Great. What would you say are some challenges with integrating pharmacogenomics into the electronic health record?
Yeah, so the informatics piece of pharmacogenomics is definitely a big issue, and there's a couple things at play. One thing is that these results, unlike other lab test results, are relevant lifelong. So if you get the test results today, that's still going to be relevant to your medical care and prescriptions potentially, 5, 10, 50 years down the road. And so when you're thinking about putting these results into the medical record, we want to do it in such a way that it's not going to get lost, in such a way that a provider many years down the road can still be alerted to the fact that you got tested and here's what it means for your care. Another important piece on the informatics side is clinical decision support and having drug-gene interaction alerts that will pop up at the point of prescribing, much like we have drug-drug interaction alerts, because oftentimes clinicians, one, they may not know the test result is in the chart, so it's good to flag with that alert to let them know that it's there, but also they may not have had the training in pharmacogenomics to understand really what to do with that result, even if they knew it was there. So having those alerts pop up at the point of prescribing gives that extra guidance to the clinicians for what to do with that result.
Would you say like storing information would also be one of the biggest challenges, like
Absolutely.
in a database, say for example?
Yes, so yeah, figuring out how to store, I think doing it in a discrete way is important so that clinical decision support, those alerts can fire off of that versus uploading a PDF report of results that can easily get lost in the chart. So exactly how we store it in the medical record is definitely very important as well. Yeah.
Great. So that's, we have Dr. Roseann Gammal again, who spoke about pharmacogenomics. Thank you so much again, Dr. Gammal. Hopefully as healthcare providers, we could take this information with us in the future and help patients. Thank you.